Welcome to the in-service about how to properly collect a wound culture. My name is Kaly Royster, and I am the nurse educator for today's in-service. I know we have several nurses coming from the medical, surgical, and critical care units with us today, so thank you all for attending. For this in-service, you will each learn how to perform the best evidence-based practice technique for the collection of a wound culture on chronic superficial wounds. This technique, if you are not familiar with it, is called the Levine technique. I know that many of you have probably been collecting wound cultures throughout your nursing careers and probably wonder why this in-service is even important. But it is always wise to be reminded as nurses of the basic principles and to make sure that your nursing care and actions match what is recommended for best practice. You have also received a handout as you are walking into today's in-service. Please refer to it throughout the demonstration and feel free to write some notes on it or highlight it as it is yours to keep and use as a reference in your daily nursing practice. Therefore, we will get started with our presentation of how to properly collect a wound culture and then demonstrate the Levine technique. Following that, we'll have a brief quiz to assess all of y'all's knowledge and understanding of the material, and then you all will be dismissed. I want to just briefly go over the learning outcomes for today's in-service. The first one is going to be that you will articulate the reasons why a wound culture will be ordered, if the procedure can be delegated, and the requirement of using an aseptic, non-touch technique during the collection process. The second outcome is recognize that a wound culture should be completed prior to the initiation of IV antibiotics, and the Levine technique includes retrieving the wound culture from a 1 centimeter squared amount of clean tissue for 5 seconds. And the last outcome is demonstrate the ability to arrange the correct steps of how to properly collect a wound culture using the Levine technique. And that will come with our quiz. So to get started, we will discuss why knowing the proper technique matters. For our patients that have one or many chronic wounds, such as venous ulcers or pressure sores, these wounds cause a negative impact to their lives, but also to all of healthcare. Each year, over 6 million patients are affected by having a chronic wound, and the healthcare cost to care for them in the United States is about $25 to $50 billion a year. Therefore, knowing how to properly collect a wound culture matters significantly, because by collecting a non-invasive wound culture to determine the cause of the infection, it will lead to the proper treatment plan being prescribed that will then lead to the patient reaching a state of being healed from their chronic wound. Overall, the right technique matters because it helps ensure accuracy, and it is the first step for the patient to be on the path to recovery from their chronic wound. Now we will watch this brief video about the impact of wound care.
Every patient has a story. Every wound does too. From one day to the next, these stories change. They evolve, constantly challenging us to combine creative thinking with new approaches. Caring for wounds is most definitely a science, but it's also an art. It's a job that requires specialized training and expertise, as well as instinct and intuition. That's what makes wound care specialists special. You never give in to a wound or give up on a patient. There is no perfect in this practice, but there is a partner, ready with a wide range of solutions designed to meet your needs. Because this is where science meets art, where innovation meets intuition, where passion meets progress, and where wounds meet their match. Welcome to the new intersection of wound and care.
Seeing this video should inspire each of you to know that as nurses, we play vital roles in our patients' lives that suffer from chronic wounds, and that we need to make sure we get them on the path to healing as soon as possible, and that simply starts, as I previously mentioned, with collecting a wound culture correctly. Now I want to test your basic knowledge about collecting wound cultures. I have a few questions I want you all to answer. The first question asks, when collecting a wound culture, does the procedure require an aseptic non-touch technique? The right answer is yes. And the reason for that is because we want to identify and prevent any microbial contamination when collecting the wound culture. Because if the sample is contaminated, then this will cause a delay in patient care. The second question asks, can the collection of a wound culture be delegated to a patient care tech? And the answer for that is no. I know as nurses we have a million things we are doing, and it is always nice when we can delegate tasks to our awesome patient care techs. But unfortunately, this is not a task that is within their scope of practice as patient care techs, and it is simply not allowed. For our last question, why is a wound culture even ordered by a provider? One of the first reasons is going to be fever, and that comes from just the chronic wound itself, because the body is fighting an infection. Another reason could be that the wound is slow to heal, and that's based on what we would consider a normal and timely progression of healing, and therefore it's now considered chronic. Another reason is that there may be some drainage present, like fluid or pus, that the provider is concerned about. Other reasons include like tenderness at the site, or even heat, swelling, and redness. All of these, as we know as nurses, are just simple and the classic signs of infection. Before we go over and demonstrate the Levine technique, I just want to point out that you should all be looking at your handout at this time, as it is the same information as that is on the slide. Just follow along using your handout, and like I said, feel free to write any notes on it. But one thing I want to mention is that when a doctor orders a wound culture, typically they'll also order some antibiotics as well that need to get started. But it's important that we all collect the wound culture first before initiating the antibiotics. So following along with our handout, you're going to see that the very first step to collecting the wound culture is simply just confirming that you need to have an order to collect the wound culture and the patient's medical record. The provider has placed that order. Then we're going to go and gather the supplies that we need for this wound culture. So whether that is some gloves, sterile gloves, if the order also includes a sterile dressing change, a culture tube with sterile swabs in it, a bag for any waste that may occur during the collection process. You'll need some medications. So that's just pain medicine. Depending on the type of wound that the patient has, may mean that you might have to do just some plain Tylenol, it's more superficial. Or if it's deeper, then you may need something stronger, like morphine. You'll also need to get a label already, so you can place it on the culture itself once you're done and ready to send it to the lab. Also grab a biohazard specimen bag. That's going to be needed to send the culture to the lab via the tube system to the hospital. You'll also want to get like a chuck pad to cover the patient, anything additional such as like goggles for yourself depending on how the wound looks, and then additional supplies to change the wound's dressing. Like I said, it's either going to be a clean dressing or a sterile dressing just depending on the provider's order, and that's why it's important to check that ahead of time and be ready and already prepared once you get into the room. So once we're in the room, we're going to identify the patient using two verifiers. Their name and date of birth is great. And then we'll go ahead and pre-medicate that patient as needed. I went ahead, as you can see, and kind of direct the patient as we need to ensure that they have privacy during this procedure, especially based on where that wound is located. And also just making sure that we have our supplies nearby, that we're not having to leave and come back from the room. I went ahead and I've already performed hand hygiene before coming on, and that way I can go ahead now and put my clean gloves on. And with my gloves, I'm just going to take off this initial dressing. And I'm also going to go ahead and rinse this wound just with some normal saline just to kind of irrigate it, to get it nice and clean before the wound culture. And obviously dry that wound, removing any excess liquid from it, any debris as well if present. And then I'm going to remove those gloves that I have on, those clean gloves, throw those away, obviously, perform hand hygiene again. And then now I'm going to put on another pair of clean gloves to do the wound culture. As long as it's not a sterile procedure, we can use clean gloves. Okay, and I've grabbed my cap from the culture tube, removing that cap. And then I'm making sure too that when I identify this wound, that I'm mapping out to follow the perfect Levine technique, is identifying a 1 centimeter squared of skin of the wound. And then I'm going to rotate that applicator for about 5 seconds. So 1, 2, 3, 4, and 5. Applying enough pressure during that process to produce any fluid while rotating the swab, and avoiding any of the edges of the wound as well is the key. Now I'm going to insert the swab back into the culture tube, making sure that I don't touch the edge and contaminating the specimen. Then I'm going to just put on some new gloves after I do hand hygiene. And I'm going to put just a new dressing. Based on this order, the provider just wanted another clean dressing. So we'll put that on the patient's wound. I can take off my gloves now. I'll label this tube with the patient's name, date of birth, their source of the location for the culture, and then also the date of collection with the time. Also putting a patient sticker on it. Then I'm going to take the tube, put it in a biohazard bag, and send that to the lab. The other important portion of this is obviously documenting the collection of the wound culture and the dressing change in the patient's medical record, putting the date and time correctly in there so that everyone that needs to know, like the lab and fellow nurses and providers, can see that wound culture was collected. So for anyone that wishes to practice with the materials after we're done with the presentation, please feel free to come up and do so. I just want to highlight that step number 8 is the most important of the Levine technique, since it's talking about that 1 centimeter or 1 squared centimeter of tissue that needs to be used to collect the culture from, and rotating that applicator for 5 seconds. These are our references for today's in-service. And then now it is time for our quiz. But before we take our quiz, I want to remind you all to just remove any notes and the handout from your desk. Once you complete the quiz, please turn it in and I will contact you to let you know if you pass the quiz or not. For those who do not pass, you will receive remediation of the material, and then you will have to demonstrate and verbalize how to collect a wound culture using the Levine technique. Again, please feel free to come and practice the technique using the mannequin if you would like. But a big thank you for attending today's in-service, and I hope you all just know and understand the value that you bring to our patients. But thank you for participating in the presentation. I hope you all have just such a great day.